Good morning, America. How are you? This is Dr. Rick Redalen, the Maverick Doctor. I'd just like to talk to you a little bit more today about the politics of medicine and why everything keeps going on this trajectory it's on, which is a downward spiral. Pretty soon there will be over 100 third world countries that rank ahead of the United States in healthcare. And Americans will be heading for Canada for their healthcare, or will be heading to Mexico. And if they're fortunate enough to go further to some of the number one places in the world, like France, the UK, the Scandinavian countries, then they'll even get superior care to that. Our government needs to take an active role in providing health care for people. That is a right for all people. We have to be able to take care of our poor and our elderly. And right now in the state of Texas, where I live, elderly are not being taken care of anymore. Doctors have stopped taking Medicare patients. And it's not the doctor's fault altogether for doing this, although I'm to my home state in Minnesota, and there aren't any places that don't take Medicare patients. So there's a vast difference between the Bible Belt here and up north where I come from. Don't know what that difference is, but I guess we think our elders and poor people are pretty important in Minnesota. I've been put on a panel by Sid Miller, our agriculture commissioner, to try to turn around healthcare in Texas. Texas ranks 50th in the United States in healthcare in a country that ranks 50th in the world. If you have a loved one here in Texas, how badly do you want them to receive care here if you know they're dying? Always keep in mind that in the United States, healthcare is the third leading cause of death. And if we actually paid more attention to what our deaths were caused from, like drug errors, drug overdoses, and inadequate treatments, we'd probably find out it's the number one cause of death in the United States. These things have got to change. We cannot put the care of the poor and the elderly on the backs of the doctors and the medical profession. They cannot support all these people by themselves. We need to pay them appropriately for taking care of the elderly and taking care of the poor that have no resources. Those of us with resources have to address this problem. Talk to your congressman. I followed Donald Trump around in his election. I went through Ohio, Pennsylvania, North Carolina, South Carolina, and Florida. And we helped win those states that it did not look like he was likely to win. Sometimes I get upset by his rhetoric, but if you do sometimes, pull out your Bible and read Romans chapter 12. God picks our rulers and we are supposed to back them. Remember that. God picks our rulers and we are supposed to back them. I hope you have a blessed day. God bless you. Take care.